to discuss the challenges our health service continues to face, but also speak to elements of the recovery that we are seeing across health and social care. But before getting into the detail, can I first of all thank our NHS frontline staff and our social care staff for the incredible efforts that they make day in and day out, and I get to see them on a weekly, more than a weekly basis in the job that I'm in, and thank them personally. But for those that I don't get to see, I and the government are eternally grateful for their efforts. Can I also say from the offset of this debate that it can only be constructive if the opposition do not deny the reality of the context in which we operate. Yeah. Looking at Sandesh Gulhane's motion in front of us, there's not a single mention of the word pandemic or the word COVID. Not a single mention, presiding officer, of the biggest shock our NHS has ever faced in its 74-year existence. To deny the severe impacts of the pandemic and the severe impacts it has had and continues to have in a health service is, quite frankly, to deny reality. Sandesh got no, I won't, if you won't mind, I'll keep going. If you were to listen to Sandesh Gulhane's opening contribution, he referenced where we were a year ago. What he forgot to mention is, of course, there's been 3 waves of the pandemic since a year ago. The Omicron wave, BA2 wave, and the BA4-5 wave, which we have just exited. So, yes, we should, of course, challenge ourselves to do better. And I accept fully, moving on to A&E waiting times, that the week ending the 11th of September, those statistics were simply not acceptable. I said as much. The First Minister has said as much. And that's why I'm pleased we've seen an immediate improvement. I accept that far away from where we want to be, but an immediate improvement, which included, of course, a 20% reduction in both 8-hour and 12-hour waits, respectively. And context, of course, is important. I accept that it's cold comfort for people waiting excessively for A&E treatment. But this is not a uniquely Scottish problem. Global health services right across the world are facing this challenge. It's why Scotland's A&E performance continues to be the best in the UK, not by a small margin, by quite a margin. But I accept, again, that more has to be done. And that's why Mr Stewart and I, Kevin, who will speak later on at the end of this debate to close it, he and I are working hard with health and social care partnerships up and down the country to reduce those delayed discharges. If we can do that, if we can get some movement in the right direction, which I accept is not happening at the moment, if we can get some movement in the right direction, that will free up capacity within our hospital, within our acute sites, which is currently under extreme challenge. I don't accept simply creating more beds in the system is the panacea. I think preventing people from coming to the front door of our hospitals is going to dramatically help. And that's why investment in our hospital at home, I will give way briefly to Brian Whittle.
Very grateful to Cabinet Secretary for giving way. I've got to say, I spoke to a deep end GP last night, and he used the phrase that their health service is designed on demand and not need. And to his point, needing to prevent, isn't it time we reset the way we looked at healthcare to prevent people's health becoming acute in the first place, which is adding to our A&E times?
Cabinet Secretary.
I agree with that point in its entirety, that the more we can prevent admission and demand in the system, the better. So a hospital at home is a great example of that. 45,000 bed days saved through the OPAT, where we can deliver antiviral treatment to patients in their home or close to home, with the prevention of them having to come in is a key plank to try to reduce that demand. On planned care, there has been elements of a recovery, not a full recovery. I'm not going to suggest that, because a recovery plan, of course, is over the course of the parliamentary term. But statistics published last week, which I know so far Sandesh Gulhane and the Conservatives haven't made comment on, shows that for the most of our outpatient specialities, 2-year waits have been eradicated, or indeed actually for over 3 quarters, they've been either eradicated or have fewer than 10 people waiting in those specialisms. Very, very briefly.
Gillian Martin.
Can I be brief? With regard to what Brian Whittle's saying about demand, the Cabinet Secretary is worried, as Dr Jennifer Armstrong from the NHS Greater Glasgow and Clyde, about the cost of living crisis increasing demand on the NHS.
The cost crisis, which has been created and now being worsened by the incompetent Conservative government, is a public health crisis. If people have to choose between heating and eating, that will have a direct impact on their health. Let me conclude, Presiding Officer, by saying that when it comes to our workforce, we will continue to try to expand that workforce. I'll give more detail of that next week. But of course, it is the case that NHS staffing in Scotland is higher per head than any other part of the UK. And in conclusion, I will give more detail of how we are matching up against that recovery plan next week and what our winter contingency plans will be. While I absolutely accept we still face challenges, Presiding Officer, due to the effects of the pandemic, let me praise our NHS staff and social care staff for the incredible, compassionate care they provide for the people of Scotland day in and day out.
Thank you.